Hey everyone, it is Tracy coming to you live from Golden Dog Adventure Company headquarters. How are you? I'm here with Dr. Lisa Boyer tonight. How are you, Dr. Boyer?
Hey, I'm great. How are you guys?
Doing well. Glad you could join us. I know usually this time of month we are doing our Ask the Veterinarian series with you in our Zoom room, but you and I talked and we decided it was important for us to go live with an update on the canine respiratory illness because there's a lot of questions, there's a lot of concerns, and I find when we get into this time of year, when the flu is starting up for humans, this disease tends to rear its ugly head as well, and people get concerns about what they should and should not be doing.
Right.
And came live with me last year about this time to give an update. And I know when you and I were talking, you said there's some new things going on that we feel people need to be aware of. So this will be an important update so people can get a sense of how they can keep their dogs protected here over the next several months.
Great.
So before we jump into that, can you just tell us a little bit about yourself? I know you've been a veterinarian for many years, so you definitely know what you're talking about.
Yeah, it's this year is 21 years of active practice as a veterinarian. My background is a combination of emergency medicine, general practice, and then I also am trained in Eastern medicine like acupuncture, herbs, things like that. And then I also have certifications in canine fitness and strength training through North Carolina State University. And I've done a bunch of continuing ed there. I do a fair amount of behavior and training with working with a variety of dogs. Dogs are kind of my life. We breed, we show, all of that. So I've got my hands in a bunch of different piles, so to speak. But I do a lot of consultations for people who maybe are looking for alternatives for their pet, or they don't know what resources are available, or they don't understand maybe what's going on with their pet, or they want me to do a records review and try to point people in a good direction and where to access the services that they need. And right now it's so hard to get into your average veterinarian, and just since COVID, and vets are booking out 6, 8, 10 weeks. You can't get in for routine care, or you can't get in if your pet is sick. And sometimes I can help bridge that gap where you don't have to wind up in an emergency room, or I can help you get to where you need to be.
Excellent. Yeah, you've been a huge resource. And over and above that, too, you've been a huge resource over the last couple of years, bringing us our Ask the Veterinarian series.
Yeah,
and if you are an official club member of Golden Dog, you will know that we have a wealth of materials in the library, specifically on a number of topics. But with the Ask the Veterinarian series, there's probably 20, 25 different episodes on different topics. So really, really good information. And tonight we're going to bring you a wealth of information as well. So I know we've got a presentation here too. I want to jump into it, and I want to make sure that we can answer all of your questions too. So if you are watching live and you have questions, feel free to chat them. We'll get to as many as we can. We're hoping to get to all of them. If for some reason you're watching this on the replay, feel free to comment below and we will get you answers as well. Great. So without further ado, let me put this up there. Okay.
Great. This is a very short presentation compared to some of the other ones that I've done, because I really want to open this up for a lot of conversation. But this one is entitled Dog Hacks, and understanding what the canine respiratory disease complex is and what is going on right now in New England and New Hampshire specifically, and what the research updates are.
And so do we need to provide a little bit of context at all, do you think, Dr. Boyer, for people who might not be familiar with this?
Yeah, that's what I kind of was going to do prior to getting into this next slide. So what happened is about 1.5 years ago, almost 2 years ago, we started to see in New Hampshire, Maine, Massachusetts, and I think it actually started in Pennsylvania, kennel cough typically, but kennel cough that was not behaving like kennel cough behaves. And I'll talk a little bit about what kennel cough is, but we saw this surge in respiratory disease in dogs where it started off like kennel cough, wound up becoming pneumonia, didn't respond to normal antibiotics. And some of the dogs, were hospitalized, some wound up on ventilators, and some actually, we had some pass away And we were getting reports from all over New England, starting in New Hampshire, then going up through Maine, Vermont, that en masse that, what is this? And nobody really seemed to be able to identify where it came from and what the organism was, or even really what do we do to take care of this. So tonight I'm going to give you a little bit of an update. We'll talk about respiratory disease in general, and we'll go from there. Okay.
Excellent.
All right. So first off, what is kennel cough? I mean, anybody who owns a dog has heard the term kennel cough, I'm pretty sure. Kennel cough is really a term that is used to describe an upper respiratory infection. So it is an infectious tracheobronchitis. So what that means is those upper airways, up in the trachea, the back of the mouth, in the tonsils, and then sometimes into the upper bronchi. And it's an inflammation and usually an infection of those airways. It is very, very contagious. You can see kennel cough, if your dog can get kennel cough from coming into fairly brief contact with a dog that is also infected, or even a human who has handled a dog that's infected, or they play with a ball that another dog has played with, or a water dish or something like that. And then they get this kind of dry, hacking cough, sounds like a seal barking. And it's usually a pretty violent cough that almost looks like the pet is vomiting. And kind of one of those classic signs of this is they're coughing up white foamy material. Okay, that's pretty typical for kennel cough. So kennel cough is often transmitted by grooming, boarding, daycare, sometimes vet clinics, hopefully not as often at the vet clinic because we take a lot of, a lot of precautions there, but having some close contact with an infected dog. And the incubation period is about 2 to 14 days. So a dog that, maybe the typical history would be my dog was at a boarding facility a week and a half ago and now he's coughing, or my dog was at a groomer 2 weeks ago and now he's coughing, or even as short as 2 days. It can be, like I said earlier, it can be transmitted not just dog to dog, but certainly if I treated a dog with kennel cough and got it on my clothing and then I didn't change my clothes or wash up and I handle another dog, I certainly can pass that on as well. Kennel cough is very interesting in that it is not just one bacteria or virus. It's multiple pathogens, and they're both viral and bacterial. And in most cases, dogs are infected by more than one. Usually the dogs that are mildly infected will get, kind of that cough or a little bit of eye discharge, maybe a little nasal discharge. But as it progresses, they get worsening eye discharge, nasal discharge. They'll get a fever. They might not eat. They'll be kind of dull and punky and not want to play. And one thing to know is if your dog gets this infection, once they seem to be clear of it, they're still contagious for up to about 3 weeks after the last day that they were symptomatic. So it's not okay to go back to boarding or daycare or grooming until 3 weeks after the last symptoms.
So even if they're not coughing, don't have any nasal discharge, anything like that, you should still wait that
Yes.
period of time. Okay.
Yeah, they're still shedding virus. I mean, that's the scary part. And people don't realize that. And they go, oh, they're clear. They can go back. Well, no, that's why we have such a problem.
Yeah, absolutely.
Okay, so what is this? What is this? So it used to be called kennel cough. We don't call it really kennel cough anymore. We call it canine infectious respiratory disease complex. And there's about 20 different pathogens that make up a standard kennel cough. It doesn't mean the dog gets all of those at once. Usually they get 2 or 3 of them. It can be Bordetella, which most people have heard of, or Mycoplasma. If they wind up with kind of a hemorrhagic or bloody pneumonia where they're coughing up blood, that's usually a strep bacteria. Adenovirus, which you may have heard of as more of a hepatitis in dogs. And it's one of those things in that DA2PP vaccine that you get, but there is a respiratory component to adenovirus as well. So it's not just hepatitis, it's also protective against upper respiratory or respiratory disease. Distemper certainly can be viral, herpes, flu, and then there's a whole bunch of other ones. And the disease will range from any very, very mild, where maybe they just hack a few times and no big deal, to severe. And before this major issue started, we would not even always treat with antibiotics. It was a self-limiting disease. The dog would cough for about 7 to 10 days, they'd get over it, and we'd move on. And that just isn't the case anymore. Okay. So you might be thinking, well, I don't have to worry because my dog is vaccinated. So this on the right is a typical vaccine that your dog would receive. It's a Bordetella bronchoseptica vaccine. Usually it's given as drops in the nose or in the mouth, sometimes given by injection. The problem is that this vaccine only protects against Bordetella. That's it. And that's only one component of the respiratory disease complex. And it may or may not be what your dog gets when they get kennel cough. So why get the vaccine? Well, there is some cross-reactivity. Dogs who are vaccinated for Bordetella tend to be less ill if they do get this. And if Bordetella is a component of the particular strain that your dog catches, you are going to have some level of protection. Your DA2PP vaccine will offer protection against two components of respiratory disease. One is that adenovirus and then parainfluenza. Now, a lot of people here don't revaccinate. They do their DA2PP and then they just titer for distemper parvo or just parvo forward. And the problem with that now is you're not titering for adenovirus or parainfluenza. The vaccine is only protective on those two, they say for at least a year. There's not a guarantee of 3 years of protection against those two viruses. And so, I don't know that it's easy to titer for either of those. And so, for somebody who doesn't vaccinate every 3 years, you may be losing protective effect from these respiratory diseases. And this may not be the year to do that. This just may be the time that you boost that vaccine, whether you really need it or not for the distemper parvo. Adenovirus and parainfluenza are not usually offered as a separate vaccine, unfortunately. Okay. And so vaccination will usually lessen the severity of the disease because, again, they have cross-protective components with other viruses. So back in 2022 and 2023, we recognized in New Hampshire lots of respiratory disease that started off anywhere from mild and then progressed to severe pneumonia. And the state vet and University of New Hampshire have been working really hard to identify what these are. They went out to the veterinary community and they asked, hey, if you get a sick dog, especially the ones that are developing pneumonia, would you take swabs and submit them to us? And oh, by the way, will you pay for us to process those samples as well? And I think the vet who wanted to submit them had to also then, pay the state to do their research, which is kind of weird, but that's how it went. So a lot of clinics donated money so that the state could do this research. They've identified as of September, potentially, I will say potentially identified, the research is not fully there, a new pathogen that is like a mycoplasma, okay? And it's preliminary, and they think it's a mycoplasma that causes this atypical respiratory syndrome in dogs. And it presents like kennel cough, but it does not respond to the normal antibiotics that the dog is given. And oftentimes when we do some testing for these pathogens, it's not coming up on the normal respiratory swabs that we would send into the lab. And we'll chat about how that goes. So some of the preliminary findings are that they've had 31 samples, and in 21 of them, they have found DNA components with the mycoplasma, or similar to a mycoplasma. And it is a mycoplasma that typically we see in humans, but it's not exactly the same. And so we have no evidence that it's, something that's passed between people and pets. So the difference with this is that these dogs are sick, and they get sick for a long time. They will cough for 2 to 3 months, maybe even more. Sometimes they'll progress to pneumonia. It's not something that we'll be able to pick up in a routine culture. And it's normally, what they think is that this mycobacterium normally was not something that caused disease, but maybe there was a mutation that happened through the course of this that now causes this bacterium to cause disease. We don't have, like I said, any evidence that can go from dogs to people, and there's definitely more research that's needed. And UNH is asking for more samples if we have ill dogs. So if you are one of the unfortunate people who have a dog that gets sick, it may, before they're treated with antibiotics, they like to try to get some of these swabs over to UNH. Your vet can help coordinate that to be able to see if it is in fact one of this organism. And so the bacteria in humans is very distinct from many of the bacteria that we know about in research. And there's just not a lot of information about this particular strain. So it's a little bit scary.
Yeah, definitely.
Now, so what do you do? If your dog is coughing, I would say, typically we would say, oh, we'll let it run its course. If it gets worse, go see your vet. We don't recommend that right now. You should absolutely go early in the course of the disease. Don't walk into the clinic. Leave your dog in the car, call, especially at an emergency clinic, but make sure they know you're coming in with a coughing dog that is potentially infectious. They're going to want to take precautions. Some clinics will see them out in your car. I mean, they don't want them in the clinic, unless they're really, really sick and need oxygen or need to be on some other intervention. When I see cases of respiratory disease, I tell people, look, it's probably kennel cough or routine kennel cough. However, it may not be. And if I treat this like a normal kennel cough case and I start antibiotics, I lose a window of opportunity to figure out if this is the routine kennel cough or the not routine kennel cough, like the one that we're dealing with the mycobacterium. And so if there is something called a respiratory PCR that goes to our lab where we take swabs of the eye conjunctiva, the tissues in the eye and then the back of the throat. And those swabs can go in for what's called a respiratory PCR. That goes to the lab, not to UNH. Sometimes that'll come back and say, yep, it's Bordetella. Yep, it's parainfluenza, all the typical ones. It may come back negative, and then your dog could still be sick and wind up with the bad one. And the reason that it's important is once I start antibiotics, I can't do these swabs. It's useless. So if you start on the routine, like most dogs would keep getting doxycycline, we put the dogs on doxycycline. Well, we do that, and a week later, your dog is really sick. I can't culture now. My culture is useless, and I can't do these swabs. So the test is not cheap. I will tell you, it's a few $100s, anywhere from probably $300, $350 to send it into the lab. But it could potentially be something very, very important to know up front. It's kind of a crapshoot. If your pup has fever, they're really dumpy, they're not eating, they're coughing, or really just don't want to have some exercise intolerance, those are signs more indicative of pneumonia, and we don't want to wait for treatment at all. Very important. In addition, I would say, well, actually, I have on this one. So what are you going to do to prevent all this? Well, this is something that is a disease of contact. So is it realistic for the next 6 months for nobody to have dog-to-dog contact? Probably not. Our dogs don't enjoy that. The Bordetella vaccine itself is licensed for 12 months. I will tell you, in my experience, it does not last 12 months. If I had a dog that spent a lot of time around other dogs, I would be boosting that every 6 to 8 months. I have dogs that go to dog shows. We do Bordetella every 6 months. It's just one of those vaccines that has very low risk in terms of reaction. And I know that from my experience that the protective nature of this vaccine is variable, and it starts, kind of waning around 6 to 8 months. By 8 months, you might have some protection, but certainly by 12, I wouldn't want to count on it. If you go to dog dense environments, so boarding, grooming, daycare, dog parks, all the places, golden dog outings, you might wish to vaccinate for canine influenza. We don't have a current outbreak right now here, but there was one recently in Pennsylvania, and dogs travel. And so if you're going to be in a doggy dense environment, your dogs are out or you're traveling, I probably would do that. In the canine influenza shots, not every veterinarian carries. It's a 2-shot series given 2 to 3 weeks apart, and it takes a little while for the dog to build immunity. So it's something you don't want to do like the week before you need it. If you're going to do any boarding or anything, I would try to plan that now if you're going to do any traveling over the holidays. Again, that DA2PP vaccine or DHPP vaccine, if you haven't given one in years because you titer, you might wish to consider boosting it anyway because of the adenovirus and the parainfluenza portions. No sharing of any toys, water dishes. I wouldn't be having people feed my dog treats, so they're getting hand to mouth contact, especially if they have handled their own dogs. If you own a brachycephalic breed, the smushy face dogs, those dogs are at much higher risk because they already have problems breathing in the first place. So really important to take these precautions for those brachycephalic breeds. And again, remember that dogs can be contagious before even showing symptoms. So 2 to 3 days before they actually cough, they've already are shedding the virus, and they're contagious for 3 weeks after the symptoms resolve. And then you should definitely avoid cough suppressants unless your dog can't rest. I mean, if they're constantly hacking, we can do cough suppressants, but really, we really want them to cough things up and to be able to clear those pathogens. So if the dog is really uncomfortable and isn't resting or just constantly coughing, I would use cough suppressants, but again, maybe only at night so they can sleep. I use them fairly sparingly.
It's a pretty scary thing.
It is. It really is. And there are some clinics, I want to say, oh, it's Maine Vet Referral. There's a veterinary clinic, emergency clinic in Maine that now has a respiratory ward specifically for dogs with this pneumonia. And then I do believe, I'm not sure if it's Port City. There are a couple of clinics that will have very specific places that you can go. I know where I do some work at Rockingham Emergency, they will definitely take pneumonia cases. But part of the scary part for me is that I hear on a daily basis, like, there's an emergency clinic called Caves. I don't know how many people know about Caves. Great clinic, good people, but they closed yesterday to all incoming. I mean, they did not, we took all their cases at Rockingham yesterday because they were just inundated, not necessarily with respiratory. And because these respiratory cases, if they require hospitalization, they're usually oxygen dependent, or they have to be in isolation. Cage space is limited. We don't have 50 oxygen cages. So you have to really know where you're headed. And if before you even go, you should call ahead because they may not be able to take you and you might get there and have to go somewhere else. So it's really important in today's environment for emergency care to call ahead, make sure if there's pneumonia that they can handle it because they may not be able to. They just may not have isolation, or in their isolation ward, they may have something else in there, like a young puppy with parvo or something, and not want to expose that puppy to pneumonia. So
now, what do you feel the risk is too for people who have multiple dogs? Can they assume that probably all the dogs in their family will get this if one gets it?
Kennel cough is super contagious. They might, I would say that every dog is at risk in your household because it's so hard to avoid sharing of common things, food, water, handling. I mean, once one dog gets it, depending on the immune system of the dog and things, I'm sorry, how much the dog will, come in contact with the other one and how healthy they are. Like, puppies are very susceptible to this. Older dogs maybe as well. The middle agers tend to do pretty well. But it's more of a really looking at the risk factors for that particular dog and how, sanitation, prevention, vaccination, minimize, the risk.
So people who are looking, to take some extra precautions with their dog daycares, boarding, going to dog parks, things like that, what would you advise? Because I know kennel cough can live on surfaces for up to 48 hours. Is that correct?
Yes, definitely. And frankly, personally, I wouldn't use a dog daycare if I didn't absolutely have to right now. Do I think that you shouldn't go to training or some of the outings? I mean, the outings for Golden Dog, outdoor outings, I think you're fine. You can manage your spacing and distance and stuff like that. Enclosed spaces are a little harder, but I still think those events are okay, provided people are kind of common sense about this. But, people who use dog daycare and people in general are boarding don't always take those precautions as we all do. And, you're taking a risk right now. I also would tell you that if you're going to vaccinate for kennel cough, I forgot to mention this earlier, that's a modified live vaccine. And with the modified live vaccine, it's a milder form of the disease. So if I vaccinate your dog for the next couple of days after they get that kennel cough vaccine, they're actually shedding a modified virus. They can actually give or get a very mild case of kennel cough after the vaccine. It's not unheard of. I mean, it's rare, but it can happen because it is a modified live. So it's not as strong as the original virus. So I would not want to bring my dog into a kennel situation within maybe 3 days of receiving Bordetella vaccine. I would want that to be done at least maybe 3 to 7 days ahead of any boarding or anything like
Yeah.
that.
Yeah, and I guess I would advise too, if you absolutely have to use boarding or daycare. Obviously, there are some very quality daycares around, and
Right.
boarding. We have many that are our partners, and they do a very good job of staying on top of this, keeping their customers informed,
Yep.
cleaning protocols, things like that. So don't be afraid to ask the hard questions. What
Yep.
is your cleaning protocol, and what are you doing to make sure that this is contained, and what's your policy regarding, if your dog is coughing or nasal discharge. So ask those questions. It's really important because you don't want this in your house, and you don't want it to spread
Yeah.
among your other dogs. I mean, I'm really concerned because we have a 14-and-a-half-year-old, and,
Mhm.
obviously we have the Golden Dog Playground here, and we have dogs that come and visit. So we are very, very particular about washing all of the bowls,
Yep.
and every single toy gets washed. I've sent out pictures and video to people so they can see our protocols on how we scrub everything, because it's so important. Because I want your dogs to be safe, but I also want my senior girl and our other girls to be safe.
Yeah,
So
I was super impressed. I actually visited your playground last week, and I was super impressed with the cleaning protocols and how clean and sanitary it was. And my dogs were there. The toys were I mean, everything was just immaculate, and you could tell everything was freshly washed in between patrons. And I think, I have no issue with that. I mean, that's really a pretty safe environment. It's not that you can't go to these places. I mean, people have to live their lives,
right.
but if you have a dog that has an immune system issue, you might want to bring in a dog sitter instead. Now, that being said, I have a friend who's a dog walker and goes and does nail trims at people's houses and things like that. And, all of a sudden she doesn't know any dogs that she treated that were ill. Now, 2 of her dogs at home have kennel cough. Well, she probably brought it home from someone house that she had been in, not knowing that dog was probably just not symptomatic yet. And now her dogs are ill. So it just is, and sometimes you can't avoid it even with excellent sanitation. I mean, when I work, I mean, my hands are washed in between every single patient. If I have anybody who's got respiratory disease, I've sprayed my clothing down, and I wear a gown and, extra layers and stuff, but it's hard, it's just really hard. And if
Yeah,
you
and I
go
think
to your
people just
vet,
have to be
extra
very,
careful.
very cautious. I mean, my son works at Mary's Dogs, and if he's
Yeah,
been exposed to anything remotely funky there, he'll, call us ahead of time. He'll say, keep the dogs downstairs. I got to go upstairs. I got to wash. I got to change my clothes.
sure.
So I know that the rescue and adoption centers too are trying to do a really good job about, keeping everybody safe as well. So
Yeah, and I probably just through this season right now, because we're into the thick of it right now in the winter and coming into the winter, I probably would just tell your son, just automatically change your clothes before he gets home.
yeah,
Clothes and shoes. I wouldn't even just wait to see if he got into something, because you may not know. And
yeah.
just coming out of that, I mean, Mary's Dogs is a great place. They do an excellent job of sanitation, but again, dogs come in, it could be 2, 3 days before you know that they're sick.
Yeah, that's true.
So
We got a couple questions here.
sure.
So Monica's asking, how long does the virus survive on surfaces and in the environment? So do you think it lasts longer than kennel cough does on surfaces?
Hard to say. I don't think so. Mycobacterium is pretty hardy in general, if it is the mycobacterium, and it depends on which pathogen we're talking about. But I would say Bordetella, generally 24, 48 hours, up to 48 hours. I would say, some of these other pathogens maybe 72 at the outside, but I think you're pretty good after that 48 to 72 hour.
Okay, good. And is there anything you can give your dog to boost their immune system that might help?
That's a really, really good question. Dogs can have elderberry and vitamin C, like we kind of do for people. That's certainly something that might help. There are, good nutrition is key. Dogs have I think it would all depend on the status of your dog and whether they're already having some kind of immunocompromise. Some dogs, they use power mushrooms and things for antioxidants. I mean, there's so many different things out on the market that I wouldn't say there's one particular thing that's better than something else. If your dog already has like cardiovascular disease or respiratory disease that's underlying, not infectious, they may need some special immune boosters as well. So those are things that if you're really concerned that you have a dog that isn't, I'm sorry about my dog barking in the background. If you really don't, I'm gonna have to let her in here. Sorry about that. You might wish to, come on. You guys being mean.
If you guys have any other questions, let us know.
You might wish to have reach out to me and we can do a brief consult and figure out what the best thing would be for your dog. You generally don't have one thing that will work for every dog. It would just depend on that particular dog's status.
Okay. And so what do you think here? What are we looking at for the future? Is this going to continue? This isn't going away anytime soon. It doesn't sound like.
No, I don't think so. And I think that, one of the things is that because it's not particularly responsive to regular antibiotics, that's a big problem. And we have, we generally would use things like Clavamox or, Augmentin or cephalosporins. They don't respond to this at all. So typically we start these dogs on doxycycline. Sometimes we have to go up to like a fluoroquinolone, like a Baytril or azithromycin, or multiple drugs if it is bacterial. And sometimes when it's viral, we still do antibiotics to kind of conquer a secondary bacterial infection that usually comes alongside.
Do you think we can see a vaccine in the future? Are they, still working towards that, or are they just
I think they need to. They don't have enough information. They really need to isolate what this pathogen is, and kind of like influenza. In right now is like every year it mutates, and we may get into that where we're kind of behind the power curve, but. I think we are making headway in identifying the organism. I mean, that's a big, huge thing. Last year, we thought maybe it was some kind of duck bacteria. I mean, there was definitely some samples that came back with like a specific bacteria from ducks or pigs. But it seems to be more this latest development is definitely a good step in the right direction.
Okay, that's good to know. Somebody is wondering, what would you recommend doing if your dog comes in contact with a dog that was diagnosed with kennel cough, but I guess before they're showing signs? Should they call their veterinarian immediately or wait?
I would wait and see if your dog develops it, because we're not going to prophylactically use antibiotics. Okay. If they're not symptomatic, antibiotics aren't going to prevent it from starting. It's just a matter of seeing if your dog comes down with it at that point. But I would isolate your dog, consider them contagious for probably 2 weeks, because in that incubation period is a 2 to 14 day period. So if your dog has come in contact with a dog that's diagnosed with kennel cough, I would take them out of circulation with other dogs for 2 weeks.
And I know that's not always possible for everybody, but what would you consider the best case scenario in a house to try to isolate? Like, what type of distance are we talking about from the other dogs?
Oh, I don't even think in a household you're going to be able to do it. I just don't. I mean, there's so much air exchange and flow, and you're walking through your house from one dog to I just think it's kind of futile at that point, unless you have a kennel space where you can really absolutely isolate that dog. I wouldn't even bother.
Or you have a family member with no pets who is willing to take your dog for a couple of weeks. Yeah.
Exactly. Yeah. Okay. You're not going to be able to prevent it in your household, really. I mean, it's kind of like that COVID thing, good social distancing, 6 feet plus, but it's almost impossible.
Yeah, keep dogs apart. Yeah, exactly. Yeah. Is this the season almost like our flu season? I mean, it kind of is.
It seems to be at this point. Like, we didn't have a lot of this through the spring and summer. I mean, things kind of settled down over the summer, but we're starting to see it again now. So, and in if you're taking your dog to training classes and I know, Lou, you just you just went somewhere for agility, right? And
I think Lucy's in agility.
Yeah. So, I think it's really important that, just get those vaccines updated and make sure you're not sharing food and water dishes. Keep distancing as best as you can. Tova's doing a really good job with sanitation. We've talked about that with Jean and what kinds of things we should be disinfecting with and how often we're cleaning the surfaces and mats and stuff. You just want to ask about sanitation protocols. And then, hopefully the people you're dealing with will be honest with you if they've had an outbreak or a case of it,
Yep, exactly. Well, thank you very much. This was fantastic information. It's always great to get an update on this because it's the biggest thing I find that people worry about this time of year with their
Oh
dogs.
yeah.
So it's always nice to give them some updated information. Unfortunately, there's not a lot of hope, but there's a lot of due diligence that people can be doing. And knowing is half the battle. So, if you guys, if we get any additional information, if Dr. Boyer hears anything else, I know she'll come to us and she'll share that with you so that you can be equipped.
And Tracy, maybe for you and your events that you're putting on through the season is kind of modifying your guidelines to reflect that incubation period would be great. Like if maybe you should put out like that dogs who have been diagnosed in the with kennel cough, they are not really should not be on any of these outings for 3 weeks post symptoms, or if they've been exposed, that knowingly exposed, for 2 weeks.
That's a very good point.
That's something
that's that gray area that I think people really need to know about. Yeah.
Yeah. And I don't think most people realize, like, they'll think, oh, my dog stopped coughing, we can go with Golden Dog today. Well, probably not. So.
Right. Or even, if you're going on vacation and your dog's in that 2 to 3 week window, you might want to, reconsider their care or postponing your vacation if you can. Yeah.
Right. Exactly.
It's hard for people.
Yeah. I mean, I don't think you should shut down. You can't shut down every dog thing. That's not practical, but if you were to, we don't need to put masks on our dogs and all that stuff, like we do with COVID. But if you, like for Golden Dog events that you're bringing your dog to, you could put some nice guidelines in place, I think, between the food and water dishes and and then also with the incubation periods.
Yeah, and from this point on, for the next several months until we get into spring, I mean, we go into our planning period anyways in December and January and shut down. Only 4 members were open. But we'll be carefully looking more at wider space trails, areas where we can all spread out more versus narrow trails. So I know Nancy's asking if they're all on leashes and kept, with apart from each other, no close contact. Would that be okay?
Oh,
and
absolutely.
Yeah, so Nancy, we're going to have to do our due diligence too, and just make sure that ability for you guys to spread out is there, and that's what we'll do.
Yeah. I mean, don't panic. I guess that's my thing. Don't panic, but just know that if your dog is starting to cough, just don't wait.
Yeah.
Be smart about it.
Exactly. Awesome. Well, thank you very much, Dr. Boyer, for taking time out of your evening. I really appreciate it. Fantastic information. And guys, if you're watching the replay and you have any additional questions or concerns at all, tag us in the community. We'll start another discussion about it. We're happy to. All right, everyone. Have a great evening, and thanks for watching.
Bye.